Salutations, folks. This is Dr. Jaffer from Western Florida. I want to talk about breathing, very important aspect of our life, and most of us, we think it's a mundane act. It isn't. You stop breathing for 5 minutes and you're dead. It's a very important function of our life. The air, oxygen in the air needs to get into our lungs, from our lungs into our blood supply, and that keeps us alive. It feeds every cell in our body. We've got 30 trillion cells and it feeds them alive. However, this act of breathing is very complex, and we as doctors don't even talk about the act of breathing and how our patients are breathing. We don't ask, how do you breathe? How is your breathing capacity and your act of breathing? But if we concentrate on that, we'll discover that there is so much more to it and so much more that it can contribute to our wellness. Look at how we breathe. Either air can go in through our nose or through our mouth. Oxygen is in the air. It's about 20%. But the air has to go through your mouth or nose, into your lungs, and finally branch out into very fine tubules. And they are the terminal bronchus, where they opens up into a bunch-like, a grape-like bunch, and it's called the alveoli, and it's lined by a very thin membrane. This is where oxygen goes into your blood supply and the carbon dioxide comes out into your lungs, ready to be expirated. So once you understand this, also there are little cilia that throw out all the junk from your lungs. They are like the sweepers. So I cannot imagine why anybody who is smoking will continue to smoke after hearing this. Smoking destroys your cilia. That's why you get a smoker's cough, because you can't clear your lung naturally by the sweeping action of the cilia. And it destroys the lung itself. If you look at a smoker's lung versus a non-smoker, it's full of this sludge. And that sludge clogs all your alveoli, reduces your lung capacity, and gives you 20 times more chances of getting a lung cancer. So please, it's not a smart idea to smoke. Anyway, let's concentrate on breathing. And a lot of science has gone into this. For thousands of years, especially in the East, there have been lots of literature about breathing. Today, in modern science, we look at yoga breathing, kapalbhati, pranayama, and all these acts, you can look it up, are teaching you how to breathe. But let me give you some more information about the breathing itself. Remember, mouth is for eating, the nose is for breathing. But 50% of America is mouth breather. And that is very bad, because when you breathe through your mouth, you dry your mouth and you cause a lot of problems, sinuses, sinus problem, and it will also aggravate your chances of getting a lung infection. Upper respiratory infection, which will become a lung infection. And especially in these days of COVID, it's very important to breathe right. So please be a nose breather. You can breathe out through your mouth if you really need to, but otherwise in through your nose and out through your nose. The nose is equipped with warming apparatus, and it also filters your air. So that's why Mother Nature made nose for breathing. When you breathe through your nose, it warms it up and goes into your lungs without causing a problem. Especially in the cold weather, try and breathe through your mouth. You start coughing, because that cold air is not appreciated by the lungs. So what's the secret of breathing right? Easiest way to remember is this. When you breathe your mouth through your nose, close your mouth and count to 5. 1, 2, 3, 4, 5. Fill your lungs up and let your stomach come out. That means you're pushing your diaphragm down. You fill your lung to capacity. And then you breathe out through your nose if possible, but if you're in a hurry, through your mouth. And 5 again. This way you empty your lungs out completely. Many times when you're exercising, you get short of breath. Guess what? The reason is not because not enough oxygen is coming in, but because the carbon dioxide has accumulated so much, it's making you breathe too fast. If you can get rid of the carbon dioxide, you can have more oxygen coming in, the fresh air into your lungs. And you want the lungs to get in. So the secret in life is to be a deep breather. Or through your nose, which is better. But this demonstration is the way you should do. Some of us are mouth breathers, and at night we find out waking up with our mouth dry. You can tape your mouth shut. There are many tapes available. You can look at online to even keep your mouth shut. It'll also stop your snoring. But shallow breathing is also ingrained in our body. 300,000 years over, we have shrunk our sinuses and our noses, so we're breathing harder. Also, after age 30, our lungs start collapsing and our bone structure changes. So by age 50, your lung capacity is 12% less. Framingham did the study on heart disease and all the longevity. They found out one important fact, that how long you live was not dependent on your genes or your exercise or your diet, but on your lung capacity. So the bigger the lung capacity, less work for your body, of course, translates to longevity and wellness. So from now on, I want you all to become deep breathers. Every time, remember, close your mouth and breathe through your nose. If possible, bring it out to your nose too. Let me suggest a very easy, simple solution. If you're not a deep breather, buy stickers, a star or a little sticker, put it on your TV, on your refrigerator, on your mirror, on your dresser, anywhere, or your phone also. When you see that, remind yourself to become a deep breather. It takes a month to build a habit. Once you get into the habit of deep breathing, it'll be a way of life. You'll contribute to you because it's the best medicine you can have. It's better than cheap, it's free, but it's most essential for your life. It'll make you live a better, more productive, and a healthy life. God bless you all.